Welcome to Group 1 Brisbane's health education program, Healthy Bump. A modified diet for women with GDM can significantly reduce blood glucose levels, the need for medication and negative infant outcomes. Yet there is a lack of diet-focused health education programs available for women with GDM in Western Sydney. Nationwide, approximately 8 to 10% of pregnant women develop GDM, and this figure is rising. Incidence is particularly high in women with Asian, Polynesian, Middle Eastern and Indigenous ethnicity. GDM can result in both short and long-term serious maternal and neonatal complications. A health education program focused on diet has the potential to assist a large number of women to be empowered to control their blood glucose levels, reducing adverse outcomes for their children and themselves. The target audience is women diagnosed with GDM living in the catchment areas of Blacktown and Mount Druitt hospitals in the Western Sydney Local Health District. 15.1% of all babies born in New South Wales are born in Western Sydney Local Health District. In Western Sydney, the rates of GDM are approaching 15% of all pregnancies. The behaviour we are seeking to change is diet, as 80 to 90% of women with GDM are managed through encouraging healthy eating and exercise. International structured education programs, which have successfully used group participation and shared experiences to help in the self-management of diabetes, are Desmond, Daphne, Carb Smart and Shop Smart. However, these are targeted at people with type 1 and type 2 diabetes. There is no evidence that locally run GDM education courses are underpinned by theory. Based on other current successful diabetes self-management programs, social learning theory will be incorporated through skill-based learning and modelling to increase likeliness to adopt behaviour change. The health belief model assists in moulding participants' health beliefs around future consequences to mother and baby if dietary changes are not made in GDM. Our goal is to create an evidence-based, nutrition-focused gestational diabetes education program for recently diagnosed women to improve confidence, knowledge and attitudes toward maintaining healthy blood glucose levels during pregnancy. In order to reach our goal, we have designed 3 objectives which fit the SMART criteria. Our first SMART objective is for greater than 70% of participants post-program to have improved attitudes and to feel confident or very confident to make dietary choices to self-manage GDM. This objective will be achieved by the strategies listed on the slide. As discussed in the social learning theory that underpins this program, confidence can be fostered by ensuring there are constant opportunities for the participants to learn from each other. Our second SMART objective focuses on improving knowledge and is to have greater than 80% of participants able to correctly recall all the 3 key nutrition messages discussed in the program. This objective will be achieved by the strategies listed on the slide. As an example, participants will be provided with easy-to-interpret workbooks. The final SMART objective is to recruit and engage a minimum 10 women per session for 2 sessions per week for the duration of the 6-month pilot period. This objective will be achieved by the strategies listed on the slide. For example, we will attempt to remove barriers to women attending the program, such as childminding and transport issues. Healthy Bump has been designed as a 2-hour nutrition-focused GDM program. It aims to reach a minimum of 260 women across the initial 6-month pilot period, which is roughly 10% of all women diagnosed annually in the target audience. This program will be delivered over a 6-month period with 2 sessions a week. Before formal delivery, we will need time for program and curriculum design and promotion. A comprehensive list of resources needed to plan, deliver and implement the program has been generated and have been considered when finalising the budget. Healthy Bump is expected to incur $1,215 per session and $8,770 of fixed overheads generated across the 6-month period. Overall, the cost of running this program for the pilot period equals roughly $40,000. The program will be evaluated through assessing the process and evaluating the impact and the outcomes. Process evaluation will commence on implementation to identify if the nutrition messages were easy to understand and were transferable to the women's individual culture and lifestyles, and if the program and website are engaging and utilised. Evaluating impact will involve analysing quantitative data from pre- and post surveys to determine if the objectives of the program were met. The outcome evaluation will provide information on whether we have met our overarching goal. This is crucial as outcome evaluation provides evidence for policy and funding decisions and would determine if this pilot program could be rolled out nationally. Program outcomes will be evaluated through a questionnaire delivered to participants at 12 weeks past their expected due date.